Hi, good morning Marco. My name is Sylvia Carmen. I'm your invigilator for the OET speaking session on the 16th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Marco Pablo.
And what is your candidate number, please?
My candidate number is 226309192.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So, let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you handle disgruntled patients?
I think unhappy patients are part of the job. After all, they're the ones who are suffering the most in this situation. That's why I try my best to talk to calm them down and get their perspective on the situation. I remember dealing with an elderly patient who consistently complained about her room. After a while, I noticed that she didn't get any visitors. It was easy to deduce that she craved companionship, which is why she was always trying to find ways to call us in. I consulted with the other nurses, and we created a schedule to drop by her room once in a while. Soon enough, she became the resident grandmother of our floor.
What do you love about nursing?
Nurses are like mediators between the multiple disciplines in a healthcare setting. At times we might work in the background, but we're valuable to the team because we bridge the gap between the patients and doctors. I have always been a people person, so I like being the spokesperson for both participants. It gives me great gratification to assist patients and help them understand their diagnosis.
Where do you see yourself in the future?
I hope by the time I have acquired the skill set and the experiences required to be considered as the best in this field. It would be ideal if I find myself working in pediatric nursing, because I enjoy working with children. My long-term plan is to become a supervisor and join the administration department. I feel that job will allow me to contribute on a bigger scale. However, even if I don't become a supervisor by then, I'd still be happy to know that I have pushed myself in this career and continue to save lives.
What is your greatest failure, and what did you learn from it?
One past decision I always struggle with is not immediately going to college after high school. I am often hard on myself, because I tell myself I could have been where I wanted to be already, and I wasted a lot of time. But I learned that discovering your true calling and passion in life isn't easy, and requires serious thought and time. Now, I successfully obtained an education, and will begin my career in a field I truly love. Essentially, I learned that I should be passionate about everything I do, and to never do anything for the wrong reasons.
How do you handle unexpected circumstances like short staffing, unfamiliar treatments, etc.?
I take a step back, analyze the situation, and determine the most appropriate plan of action. If we are short-staffed and have to take an extra patient, I will modify my plan and focus on my priorities. If I have to give an unfamiliar treatment, I consult any available materials, such as nursing policies and procedures, or manuals, or even ask for help. Whatever the circumstance, I welcome a challenge, and always make learning my main priority.
Great. Thank you very much for sharing that. So, let's move on to roleplay now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the roleplay is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the roleplay as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the roleplay. You will start the roleplay after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the roleplay card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Marco Pablo. I am a registered nurse from the hospital to do the checkup following Sylvia Carmen's right hip replacement. For confirmation, am I talking to Sylvia Carmen?
Good morning. Yes, I am Sylvia Carmen.
Hello Sylvia, nice to meet you.
Nice to meet you, nurse.
Tell me Sylvia, how are you doing after the hip replacement?
I am feeling better, and also, I can now walk much easier.
That's good to hear.
Well, nurse, I am feeling tired though, as I have been sleeping badly the last few nights.
All right. Sylvia, can you please elicit the possible reasons for your poor sleep?
Nurse, my face feels a bit painful, and I had a headache for a few days. Also, I had a cold last week and my nose is badly blocked, which is disturbing my sleep.
Do you have any stress or anxiety?
Actually, nurse, I am not anxious or stressed.
Okay. For my better understanding of your condition, can I ask you a few questions that will give me more insight into your headache?
Sure, you may please ask.
Thank you, Sylvia. I would like to know the severity of your headache. How would you rate your headache on a scale of 1 to 10, where 1 is the least pain and 10 is the worst pain you ever had?
Definitely, nurse, the headache is bad, about a 7 out of 10, I would say.
Sorry to hear that. May I know whether the headache gets worse when moving?
Yes, I feel it gets worse when I lean forward.
Okay. Do you have a fever associated with this?
No, I don't have a fever.
And what about the change in appetite, loss of sense of taste and all?
Nurse, I am eating less, as it hurts, while chewing.
Oh, I see.
Also, I have lost my sense of taste.
All right. Thank you for answering my questions. Sylvia, try not to worry. From your words, the symptoms suggest acute sinusitis, which is inflammation of the sinus lining at the back of the nose.
Okay.
This is a very common condition, which is usually self-resolving, and not a serious issue. So, no need to be panicked about it.
All right.
Now, I will recommend some self-help treatments for your condition.
Okay, nurse.
It is recommended to consume more fluids, because high fluid intake will loosen secretions.
Okay, I will consume more fluids then.
That's great. Also, gently blow the nose to clear the sinus. And, try to keep your head elevated when lying down.
All right. I will do that.
Following my suggestions will help you to deal with your condition to a greater degree.
Nurse, I will do what you have suggested. But, I think, I need to see a GP.
Your thoughts are sensible. I suggest you see the GP only if there is no improvement in 1 week.
Is it?
Yes, Sylvia. So that the GP will prescribe for appropriate treatment, and also can rule out other underlying conditions if any.
Okay, nurse. I understand that.
I reassure you that, if you follow my suggestions, you will get cured, and can manage your condition much more effectively.
All right, nurse. I will try your suggestions initially. And if there is no improvement, I will see a GP.
That's perfect. Thank you for accepting my suggestions. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OHG speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.